Hi, my name is Goldberg. I'm a sports medicine physician with the Cleveland Clinic. I'm the medical director for the 2012 Rite Cleveland Marathon. And we're here today to talk about some training tips for the Cleveland Marathon this year. We're leading up into a marathon on May 20th. The weather's been great and nice, and hopefully everyone's been out running outside and getting in their long miles. One of the important things that we like to think about when we're leading into a spring marathon is the weather changes and making sure that we're prepared for whatever the weather may be that day. Layering clothes is very important, and practicing in the clothes that you're going to wear so that you're comfortable and you're not wearing anything new. Running shoes should be changed every 350 to 400 miles, and you want to make sure we don't change those the day before the race. Certainly want to get some miles in beforehand. Other things to consider are nutrition leading up to the race, making sure that you have a healthy, moderate diet. So making sure you get in proteins and carbohydrates and not eating any new foods. Especially the day before a marathon, we like to make sure and think about not eating overly fatty foods or foods that you haven't been exposed to before. Making sure you're well hydrated the week before. A lot of people think that they're going to run 26 miles and they really have to drink a lot of fluid so that they're well hydrated. But really drinking to your thirst the week before, making sure that you're just hydrated and not overly so. And then race day hydration changes really with the weather. On a colder day, you might not get thirsty quite as quickly because you're not sweating as much, so drink to your thirst. If you get a headache and your mouth is dry, you know that you really need to pick that up a little bit and make sure that you drink throughout the race. The race stations and aid stations are there so that when you're thirsty it's available. You don't necessarily have to drink at every aid station. There's usually water and some carbohydrate electrolyte drink that's available. And make sure you know what your race is serving so that you are ready and you've trained with it so that your stomach doesn't get upset and surprised by a new fluid. Also, if it's really hot out, you want to make sure that you drink a little bit more. A lot of times you'll get thirsty quicker, so again, listen to your thirst. That's probably the most important thing, is to not overdrink, but to make sure that when you are thirsty, you do drink. Also, on hot days, you want to make sure that you're running to your ability. It may not be the best day to get a personal record, because in the heat, it taxes your body more, and so you have to adjust a little bit for that. In the Cleveland Marathon, we have an alert system that lets us know the risk factors depending on the weather. And we use a lot of different factors that go in to determine it so that we can tell you, is this a day that you really have low risk for overheating, low risk for any sort of negative events. And on those days where the green flag is up, you can go out and try and get your best. But when you see a yellow flag or a red flag or certainly a black flag, those are the days that you have to sort of back off and listen to your own body and make sure you don't exert yourself and put yourself at risk for heat illness or other injuries. Really thinking more systemic injuries rather than orthopedic or musculoskeletal injuries. We do have race tents for medical care at the race, but the race, you're responsible for taking care of yourself and listening to your body. You may experience blisters and soreness, and it's hard to know exactly when to stop when you have those pains. Sometimes it might be as simple as a chafing or something, and then you can ask for some Vaseline and rub it on and push on. If you're having muscular soreness where you're just feeling tightness or achiness but you're not limping, certainly it's worthwhile to push on and try and get through that. But pain that is causing you to limp, that's preventing you from being able to maintain your stride in a comfortable fashion, that needs to be considered as a reason to back down your speed and maybe drop out of the race. There's always another race, although it's hard to think that way when you put so much training in. Mentally, a lot of times when you're at mile 17 or 18, a little ache or pain that at mile 1 you would never think about becomes much more larger in your mind, and it's hard to know how to react to that. You really have to be prepared for that mental toughness that you sometimes lose when you're tired. So using the limping rule is a good way to decide, should I continue, should I not? And certainly if you have pain that is causing you to limp that's progressing and getting worse and worse, you really want to consider backing off and walking and seeing if it calms down. Most of the time the race day is going to go great. The weather hopefully will be beautiful. It's been beautiful so far this spring, and you can expect to have a successful race if you've put the time in training. The hardest time is leading up to the race, making sure that you have done what you need to do and being confident that your training was successful. So as we go into the month or so ahead of the race, we really want to make sure that you're following your training guidelines, that you're listening to your body, and if you're starting to have aches and pains, that you're addressing them properly with rest, ice, cross-training, maybe some anti-inflammatory medications if needed, but to really listen to your body and make sure you're doing the adequate running and strength training and cross-training that you need to so you're prepared for that day. That's what makes the mental toughness the easiest, if you know you did everything.